I got the oddest WhatsApp message this morning from some market informant saying that the global market for social determinants of health will be $180 billion. And I thought, good heavens, a global market for social determinants of health. I didn't think there was such a thing. And that it would be by 2030 worth $180 billion. Who knew? Who thought? The reason I mention this, apart from being a little shocked by this little bit of news, is that when I started on this journey, social determinants of health, people said, what? What are you talking about? What is that? And now there's a global market worth $180 billion or something like that. I may have a few zeros wrong, but when you're up at that level, who cares? And I am going to the G20 Health Working Group in Brazil next week. Brazil has the presidency of the G20, and I've been asked to make a presentation to the Health Working Group about social determinants of health and health equity. So we are on the agenda globally. But I want to today talk about Britain as an exemplar, not that it's necessarily the most important thing in the world, but I think it is a good exemplar. We are, as you probably noticed, doomed to 5 weeks of ghastliness known as an election campaign. We have dishonest tosh from the ruling government and nothing of substance from the opposition Labour Party. And we've got to put up with this drivel for 5 weeks. It's depressing. What I would like the conversation to be about is this: social justice and health equity. And I'll show you why. The opening line of my book, The Health Gap, was why treat people and send them back to the conditions that made them sick? Given the underfunding of our National Health Service and the fact that it's creaking, people think a great deal about the NHS, and rightly so. My concern, though, is with the conditions that make people sick, the social determinants of health. And again, in my 2020 Health Equity in England, the Marmot review, 10 years on, we had initially 6 domains of recommendations. A bit of background, though, as you heard in the introduction, I chaired the WHO Commission on Social Determinants of Health. We published in 2008. It was a global commission for high, middle, and low-income countries. And we said that our recommendations needed to be translated into a given national context. And I was invited by the British government, Gordon Brown was then the Prime Minister, to conduct a review in England to say how we could apply the findings and recommendations of the Global Commission to one country, England. And hence these recommendations: give every child the best start in life, education and lifelong learning, fair employment and good work for all. Number 4, really radical for a rich country: everybody should have at least the minimum income necessary for a healthy life. Number 5, healthy and sustainable places and communities. We're doing quite a lot on housing now. Number 6, taking a social determinants approach to prevention. We've added 2, particularly in the light of COVID, tackle racism, discrimination, and their outcomes. And number 8, in a way, was there all along: pursue environmental sustainability and health equity together. In my 2020 review, the Marmot review 10 years on, updated with a year of COVID, we documented that life expectancy had been increasing about 1 year every 4 years. This takes it back to 1989. We could take it back to the end of the First World War. And with some interruptions, life expectancy increased about 1 year every 4 years for women and for men. In 2010-11, there was a break in the curve. The rate of improvement slowed dramatically. Then it fell in 2020. In fact, from 2010 to 2020, there was no improvement in life expectancy. That's appalling. As I said, we've become used to it improving 1 year every 4 years. What happened in 2010? We had a new government elected, Conservative-led coalition government. And I came into all of this. I maintain the fiction that I am not party political. Maybe a fiction, but I look at the evidence. I don't start from the proposition that one party is better than another. I start from looking at the evidence, and something clearly went wrong in 2010. The government said, surely you can't be suggesting it's anything we did that could have led to this slowdown. Maybe we reached peak life expectancy. So we looked at other countries. The slowdown in the UK and in England was more marked than in any other rich country except Iceland and the United States. No, we had not reached peak life expectancy. And look at this comparison. If you classify people by where they live, classify where they live by degree of deprivation, you see a social gradient. The greater the deprivation, the shorter the life expectancy. Now compare London with the Northeast. For the least deprived 10%, there's very little difference between London and the Northeast. Northwest is similar. If you're rich, it doesn't much matter where you live. The greater the deprivation, the greater the health disadvantage of living in the Northeast compared with London. Or putting it another way, the consequences of deprivation for ill health are bigger in the Northeast and the Northwest and Scotland than they are in London. Now look at what happened over time. The dotted line, London, 2010-12, 6 years later, life expectancy increased in London across the social gradient. In the Northeast, life expectancy fell in the poorest 10%. It didn't rise. For the bottom 6 deciles, you only get some improvement in the top 4 deciles. So this is where we were pre-pandemic. Life expectancy had stopped improving, inequalities were getting bigger, and life expectancy for the poorest people was getting worse. Now, I work on the assumption, Department of Social Policy and Intervention, I work on the assumption that the health of the population tells us a great deal about how well society is meeting the needs of its members. If health has stopped improving, society has stopped improving. If inequalities are getting bigger in health, are getting bigger, inequalities in society are getting bigger. If health for the poorest people is getting worse, social conditions for the poorest people are getting worse. That's where we were pre-pandemic. So we've got 3 problems in recent times: a decade plus of austerity, the pandemic, and the cost of living crisis, each of which made health inequalities worse. The government that was elected in 2010 made no secret of what they were seeking to do. It was austerity, a smaller state, and they achieved it. Some other things that they claimed to have achieved, they hadn't, but I'll show you that in a moment. But this one they achieved. In 2009-10, public sector expenditure was 42% of GDP. That went down year on year. By 2019, that 42% had become 35%. 7% of GDP cut from public sector expenditure. 7% of GDP. In today's figures, 2023, GDP of the UK is about 2.2 trillion pounds. 7% of 2.2 trillion is a lot of billions, about 150 billion pounds a year annual reduction in public sector expenditure. Good heavens. And then 2020, 21, a massive increase with the pandemic. The Chancellor said, here's a trick question. Can you remember who the Chancellor was in 2020? We've had 7 chancellors since the Brexit referendum, but I'll give you a clue. He's now the Prime Minister. You can probably remember who the Prime Minister is. We've only had 5 Prime Ministers since the Brexit referendum. Talk about chaos. But the Chancellor said, whatever it takes, whatever it takes. Now that's interesting. Faced with the global financial crisis back in 2009-10, the Chancellor said, it's a moral necessity, it's an economic necessity to cut spending. We'll become like Greece. Well, actually, Greece is looking quite good at the moment. But the Chancellor in 2020-21 didn't say, we'll become like Greece. He said, whatever it takes. Oh, you mean this was not back in 2010, not a moral or economic necessity. It was a political choice. Child poverty. Child poverty had been coming down, defined as living in a household at less than 60% median income. It was one of the goals of New Labour to reduce child poverty, and they did. It went up a bit with the global financial crisis, but it was then coming down again. After housing costs, child poverty went up from 27% to 30%. Went down with the Chancellor's spending in the first year of the pandemic, but it's now rising, set to rise to about 34%. Wow. From 27 to 30%, and then to go up to 34%. So particularly child poverty. Pensioner poverty went down, the triple lock. A cynic, not me, would say, well, pensioners are more likely to vote than young people, and they're more likely to vote Conservative, so this was a bribe. I would never say such a thing. But the fact is that the age distribution of poverty has changed. There wasn't so much difference back here in the 1990s, but now it's child poverty. And deep poverty makes up a larger proportion of poverty. So poverty defined as less than 60% median income. Deep poverty is less than 50%, and very deep poverty less than 40%. So you can see that poverty is biting more deeply. And we don't look good. UNICEF report card 18 compares relative poverty, less than 60% median income. And, you know, we could be like Denmark, Norway, Germany, Australia, but we're not. We're more like the US and Colombia. Italy doesn't look so good either. And If we look at the period 2012 to 2021, this is again UNICEF report card 18, we had the biggest increase in child poverty of 39 countries. The government's been boasting that they've taken hundreds of thousands of children out of absolute poverty. I don't think they have much to boast about. Firstly, the international benchmark is relative poverty, and we had the biggest increase of 39 countries. But I won't go into it, but the measure of absolute poverty they use is suspect in the extreme. I heard the Chancellor, George Osborne, being interviewed a few months ago, still defending the legacy of austerity. He says, if you have a very large crash, the country pays the price. A country has to live within its means. The economic policies pursued after 2000, we had the strongest growth in the G7. More jobs were created, a lot to be proud of. Britain in 2016 was buzzing. People were looking at the UK and saying, that's the example we want to follow. And I listened to this and thought, where was I? I thought I was in the UK in 2016. I don't remember that. What actually happened? UK real wages, comparison countries. This is what happened to real wages after 2010. Here's 2016 when we were buzzing. We were the example that all these other countries wanted to follow. They said, we want our workers to be paid less. We wish we were doing what the UK is. We're immiserating people. And that's the aim of government, to make people worse off. And we'd like to be more like the UK. Come off it. How about a bit of truth? How can you have a sensible debate about policy when one of the architects of policy can't bring himself to tell the truth? This is the evolution of real annual average wages. Went up a bit under the Conservatives, went up quite a bit more under Labour. We were getting up to be the average of peer countries, and then went down dramatically. So by 2022-23, UK real wages are lower than 18 years ago. That's not a great success story. Austerity. This is total government spending. I've shown you this. It went up dramatically under Labour, came down under the Conservatives, and these are peer countries. That's the average for peer countries, and we got much worse. Government spending on healthcare went up a little bit under the Tories, went up a lot under New Labour. As percent of GDP, came down quite sharply under the Conservative-led government, compared with what happened to the average in peer countries. I've said this is not primarily about the NHS, but let me stick with the NHS just for a moment. NHS waiting lists. The government says, yes, there's a lot of people waiting, but that's because of the war in Ukraine. It's because of the pandemic. It's because those naughty doctors went on strike. Well, let's have a look at the evidence. This is the number of people waiting for NHS treatment. If we take January 2009 as 100 as the benchmark. In 1997, it was 230. New Labour brought it down dramatically. And then by 2019, it was 190, nearly doubled. That was before the war in Ukraine. That was before the COVID pandemic. That was before the cost of living crisis. That was before the doctors' strike and the nurses' strike. That was due to underfunding of our healthcare system. And we had a lot of people waiting. It got worse with those other things, but it had already nearly doubled in the decade before the pandemic. Share of A&E attendees seen within 4 hours, down and down and down and down. This is not good management. We published a report in January, Lives Cut Short. We did something I'd wanted to do for a long time. People like me commonly talk about the poor health for the poor. But health follows a social gradient. I showed you the graph in London and the Northeast a few minutes ago. So we said, let's, instead of focusing on the most deprived, let's focus on the least deprived. And let's ask the question, how many excess deaths are there because people don't have the low mortality of the least deprived? And the greater the deprivation, the greater the number of excess deaths over the period 2011 to 2019. So if we look over that whole decade, there were 1 million excess deaths linked to deprivation. Now, 2009-10 average, there would have been excess deaths linked to deprivation before 2010 because there was a gradient. But there were 148,000 extra. So there were 1 million excess deaths. Of that 1 million, 148,000 could be considered as extra related to the decade of austerity. And then in the first year of the pandemic, there were a further 28,000 excess deaths linked to deprivation. This is enormous. When the former chancellor said we were the envy of the other rich countries, really? Did he any time at all consider health and ask, is this something to be proud of? And we published this report, again, 2024, a few weeks ago. Healthy life expectancy by sex and region in the Northeast particularly, but the Northwest as well. Very high or very low unhealthy life expectancy. Very poor unhealthy life expectancy, healthy life expectancy. And you can see big differences. And we had, I'll come back to that in just a moment, we had, in my 2010 report, elaborated the idea of proportionate universalism. The default position of Anglo-Saxon social policy is you target the worst off, means-tested benefits. A more Nordic approach to social policy is you have universalist policies. So we said, let's combine them. Have universalist policies with effort proportionate to need. So here's social distribution. Let's say this is less deprivation, longer life expectancy. We could call it leveling up. If you have means-tested policies, you focus on the worst off. Yes, you might help them, but what about the people who are above the threshold of intervention, but have worse health than those above them in the social hierarchy? So we said, universalist policies with effort proportionate to need. Look at this. This is from our recent report. It plots life expectancy in 2010-12 for each local authority in England, and then looks at the decline in local government funding. And what you can see is this clear relationship. The shorter the life expectancy, the bigger the drop in the subsequent drop in local government funding. So in the sickest areas, government funding went down by about 50%, by much less in the healthier areas. In what moral universe could this be justified? This is effort inversely proportionate to need. The shorter the life expectancy, the greater the need. The greater the need, the bigger the reduction in funding. Was this a deliberate policy to increase health inequalities? And if it was not deliberate, but it was somehow absent-mindedness, does that make it any better? And where's the discussion of all this in what passes for political debate going on at the moment? Is anybody referring to this? Is the government acknowledging it? Is Labour drawing attention to it? I'm drawing attention to it. And we're not doing well. You notice I drawn on that well-known left-wing journal, the Financial Times. Look at this. This is countries' disposable household income adjusting for purchasing power. Compare Norway, the green, that's Switzerland is the grey bar, the US, the red is the UK. For people in the 90th centile of income, the UK and Norway had about the same income. Slovenia much lower, Switzerland and the US much higher. At the 90th centile, incomes are much higher in Switzerland and the US than they are in the UK and Norway. And these are trends over time. Now look at the 50th centile, the median. The UK is much poorer than Norway. The US is about the same as Norway. Switzerland is higher. Now look at the 10th centile. The US is way, the UK is way below Norway. In fact, the UK is below Slovenia. Looking at this, you would say, we are a poor country with some rich people. And that's part of my argument, why we want proportionate universalism. We've got to deal with the whole of the distribution. Further evidence from Bern Murdoch in the Financial Times. Look at GDP per capita, again, adjusted for purchasing power. Here's the UK. London is the richest region. If you take the richest region out of the UK GDP per capita, the average goes down by about 14%. In Germany, if you take the richest region out, Munich hardly changes. In the Netherlands, if you take the richest region out, Amsterdam goes down by perhaps 3 or 4%. In the US, take out Seattle, and it goes down by 2%. The UK, if you take out the richest region, London, our income per person, adjusting for purchasing power, is the same as Mississippi, the poorest US state. We are, in the UK, we're Mississippi plus London. The government was talking about levelling up. They did nothing. Zilch, nothing. The levelling up secretary is standing down at the election. We are Mississippi with London. I don't think that's a viable future for the country. Then came COVID. We said from the beginning that COVID would reveal the underlying inequalities in society and amplify them. And so it proved. Here's the social gradient in all-cause mortality. And here's the social gradient in COVID mortality. Very similar to the all-cause gradient. Slightly steeper for COVID because of exposure and frontline occupations, crowded living conditions. But it means to deal with COVID, yes, we need vaccination. Yes, we needed social distancing, but we need to deal with the underlying inequalities. And when I said it amplified the inequalities, here's life expectancy 2018 to 20 compared with the previous triennium. Life expectancy went down for the poorest 40% in the country, for women and for men, and the greater the deprivation, the greater the fall. For men, it didn't go up at all. For women, it did go up for the top 60%, but for the bottom 40%, in general, the greater the deprivation, the greater the fall. And it's not just life expectancy, but healthy life expectancy. For women, women in the most deprived 10% can expect to live a third of their lives with poor health. So they've shorter life expectancy, and more of those fewer years are spent in ill health. And then the cost of living crisis. I said the government likes to boast that they've taken hundreds of thousands of children out of absolute poverty. The absolute poverty measure doesn't bear examination. The Joseph Rowntree Fund publishes figures on destitution. In 2022, 3.8 million people were in a state of destitution, 1 million children. Destitution is defined as doing without 2 or more of 6 basic needs: housing, heat, light, food, clothing, and toiletries. Wow. And a 2.5-fold increase in 5 years in destitution in children. And of course, work is supposed to be the way out of poverty. This is the percentage of working age adults in poverty in families where at least one adult is in work. So if we look at the UK as a whole, this is after housing costs. 2/3 of families in poverty are in households where at least one adult is working. They're in poverty because they're lowly paid. And if they're not in work, let's look at universal credit. The Trussell Trust and the Joseph Rowntree Foundation calculated the cost of meeting essentials, which are pretty much like the 6 that I mentioned in relation to destitution. This is what universal credit gives you if you're a single person and if you're a couple. And this is the cost of meeting essentials. If you're on universal credit, you get about 70% of what you need to meet the essentials. In other words, if you're on universal credit, we guarantee you will get sick because we don't give you enough to eat or to heat your dwelling or to have appropriate clothing and the like. And we've drawn attention. We've drawn attention to fuel poverty. Fuel poverty has 3 causes: poverty, the price of fuel, and the quality of housing. And what I just said. In a recent report, we said that 1/3 of households in the UK are below the minimum income standard and living in households that do not meet level C of the energy conservation measure. And the consequence, excess winter deaths, damaging children's lungs, damaging children's development. And I said 3 causes: quality of housing, poverty. Look at this. If you're in the richest 10% of income in France, you spend about 6% of household budget on energy. If you're in the richest 10% in the UK, you spend about 6% of the household budget on energy. If you're in the poorest 10% in France, you spend 10% of your household budget on energy. If you're in the poorest 10% in the UK, you spend nearly 18% of your household budget on energy. That gap in the percent of household budget spent on energy, that gap between the richest 10% and the poorest 10% is the biggest in Europe. The UK is not a good place to be poor. And we hear a lot about the tax burden. I'd never make a politician. Look at this. It depends whether you look at OECD numbers or the Office for National Statistics. Our tax burden has been about 34% of national income. The G7 average is up at around 37%. The EU 14 is 40%. We are a low tax country. And there may be a lot of talk about high levels of taxation. We are a low tax country. And when I hear government people, all the opposition say, oh, we want low taxes, which part of the social determinants of health that I've gone through and the ones that I haven't? Cut in funding to local authority, increase in child poverty, failure to take people out of poverty who are in work, and on and on and on. Which part of that would you like to make worse by lowering taxes? Wow, what a miserable cuss I am. All this ghastly stuff. It's awful. Why am I not depressed? I'll show you. There are more than 40 places in England and Wales that have declared themselves Marmot places. In fact, by the end of the year, we expect to have 50. Coventry was the first, declared itself a Marmot city. Then Greater Manchester said there'll be a Marmot city region. Cheshire and Merseyside, Lancashire and Cumbria, Luton, the London Borough of Waltham Forest, Gwent in Wales, Southwest region, Leeds, and on and on and on. This is really exciting. What these places have said is not, oh my God, we've had our budgets cut terribly, there's nothing we can do. I've shared platforms with Andy Burnham in Greater Manchester, with the Mayor of Liverpool, and so on. And they say, what we want to do is make Manchester, make Liverpool the best place in the country to live. And we're going to do the best we can with the hand with which we've been dealt. And for the first time, we've got business involved. Legal and General, a big financial services and insurance company, approached us and said, what could business do to improve health and reduce health inequalities? So they sponsored us to produce a report, not just for L&G, but for business in general, the business of health equity, the Marmot Review for Industry. And we said 3 domains: good quality conditions for your workforce, goods and services, and impact on the community, the environment, and the like. We're working with the East London Foundation Trust, and a public health doctor there said, produce what he called East London Foundation Trust's Marmot Mountain for Luton, which is covered by the East London Trust. He said the East London Foundation Trust as a training and employment provider, and here's universal and targeted. So she adopted the principle of proportionate universalism, our service users, and the impact on the wider Luton community. I said I'm not party political, but I can't help but take note of this. When Keir Starmer last year produced his health mission, in a technical appendix to the health mission, it said The next Labour government will amplify the approach of Marmot cities like Greater Manchester and Coventry by making England a Marmot country, tackling the social inequalities that influence health. I must remind them of that statement. Let me finish. I said I've given you some rather grim news, but I've also given you something positive, I hope. Raymond Williams said to be truly radical is to make hope possible rather than despair convincing. Thank you.